Hand infections are emergencies and require early diagnosis and prompt treatment. Staphylococcus species are responsible for the majority of cases and is commoner in manual workers, farmers, and fishmongers. It can be classified as simple or severe infections. The simple infections are infections of distal, phalangeal, pulp, phelons, also referred to as Whitlow or pulp space infection, and paronychia, which could be acute or and chronic, and subepithelial blisters and abscesses. So herpes from septic granulomas and carbuncular infections as from sebum of hair follicles and sweat glands. Severe infections suppurative tenosynovitis, facial space abscesses, acute osteomyelitis, acute septic arthritis, acute lymphangitis, and allied infections could be a combination, and also complications of acute infections. The causes are Staphylococcus aureus and Staphylococcus epidermidis, also streptococcus pyogenes, and fungi and viruses. The symptoms are pain, swelling, blistering, fever, skin discoloration, and loss of function. In chronic types, there may be no pain or fever. The signs that are usually elicited are fever, swelling, tenderness, discharge, and stiffness. Investigations are FBC, ESR, CRP, blood culture, random blood sugar, gram stain and culture of discharge, and X-ray, nail clippings for chronic paronychia. The main treatment objectives are to eradicate infection early and aggressively, to prevent complications such as stiffness of the joints and septicemia, non-pharmacological treatments, elevation of the affected hand, bandaging, protective wear, physiotherapy, surgical drainage of abscesses, and fasciotomy in compartment syndrome. Pharmacological treatment. So for first line treatment, in the treatment of suspected simple staphylococcus infections, you give flucloxacillin oral in adults 250 to 500 milligrams 6 hourly for 7 to 14 days. And in children 5 to 12 years, you give 250 milligrams 6 hourly for 7 to 14 days. And 1 to 5 years, you give 1 to 5 milligrams 6 hourly for 7 to 14 days. Less than 1 year, you give 62.5 milligrams 6 hourly for 7 to 14 days. Second line treatment, you give clindamycin oral in adults 150 to 300 milligrams 6 to 8 hourly for 7 to 14 days. In children 12 to 18 years, you give 150 to 300 milligrams 6 hourly for 7 to 14 days. 1 month to 11 years, give 3 to 6 milligrams per kilogram 6 hourly for 7 to 14 days. For the treatment of suspected severe staphylococcus infections, first line treatment, we give cloxacillin IV in adults 500 milligrams 6 hourly for 7 to 14 days, and in children 5 to 12 years, give 250 milligrams 6 hourly for 7 to 14 days. 1 to 5 years, you give 1 to 5 milligrams 6 hourly for 5 to 14 days, and less than 1 year, give 62.5 milligrams 6 hourly for 7 to 14 days. The second line treatment, you give clindamycin IV or IM in adults 300 to 600 milligrams 8 hourly for 14 days, and children 12 years to 18 years, you give 150 to 675 milligrams 6 hourly for 14 days. 1 month to 12 years, you give 3.75 to 6.25 milligrams per kilogram 6 hourly for 14 days. For the treatment of chronic paronychia, first line treatment, you give itraconazole oral in adults 200 milligrams daily for 7 days, and in children more than 12 years, you give 200 milligrams daily for 7 days. And 1 month to 12 years, you give 3 to 5 milligrams per kilogram daily for 7 days. The use of itraconazole is associated with potentially life-threatening liver toxicity. So you monitor liver function while on long-term therapy. After giving the itraconazole oral, you give miconazole tincture topical. So in adults and children more than 2 years, you apply 12 hourly to affected area. Two for fluconazole, you give 150 to 300 milligrams weekly. That's the second line treatment. And for children 12 to 18 years, you give 50 to 100 milligrams of fluconazole oral weekly. And 14 days to 12 years, you give 3 to 6 milligrams per kilogram weekly. Or you give clotrimazole topical. In adults and children, you apply 8 to 12 hourly to affected area. Or you give nystatin cream topical. In adults and children, you apply 8 to 12 hourly to affected area. Or you give iconazole cream topical. In adults and children, you apply 8 to 12 hourly to affected area. Or you give cyclopyrox cream or cyclopyrox cream topical. In adults, you apply 8 to 12 hourly to affected area. In children more than 10 years, you apply 8 to 12 hourly to affected area also. Less than 10 years is not recommended. Third line treatment, you give greaseylfulvin oral. In adults 500 milligrams daily. You double in severe infection for 4 weeks. In children 12 to 18 years, you give 500 milligrams once daily or in 2 divided doses. It may be doubled in severe infections for 4 weeks. So in for 1 month to 12 years, you give 10 milligrams per kilogram with a maximum of 500 milligrams once daily or in 2 divided doses for 4 weeks. And then you give miconazole tincture topical. In adults and children, you apply 12 hourly to affected area. For the treatment of septic granuloma, first line treatment, you give copper sulfate stone as blue stone topical. In adults and children, you apply to the affected site 12 hourly. Or you use hydrocortisone cream 0.5 to 2.5% topical. In adults 0.5 to 2.5%. Apply 8 to 12 hourly to affected area or areas. In children 0.5 to 1%. You apply 8 to 12 hourly to affected area or areas. Or you can use clobetasol propionate, clobetasol propionate cream 0.05% topical. In adults, you apply 8 to 12 hourly to affected area or areas. In children more than 12 years, you apply 8 to 12 hourly to affected area or areas, but less than 12 years is not recommended. You use betamethasone dipropionate cream 0.05% topical. In adults and children less than 12 years, you apply 12 hourly to affected area or areas. Referral criteria, you refer to appropriate specialist if the patient does not improve.